An employee is signed off work with severe stress. Her GP issues a fit note saying she is not fit for work for 4 weeks. She sends it to her employer, expecting support and understanding. Instead, her manager replies with, "We do not think you are that unwell. We need you back in the office next week." That situation might sound shocking, but it happens more often than people realize. And it raises a very important question. What exactly does a fit note mean, and what are employers legally required to accept? Because honestly, there is a lot of confusion around fit notes in UK workplaces. Some employees think a fit note guarantees full sick pay. Others believe employers must automatically follow every recommendation written by a GP. And employers themselves sometimes misunderstand what their obligations actually are. So, let's break it down properly. A fit note, sometimes still called a sick note, is medical evidence issued by a healthcare professional confirming that an employee may not be fit for work. It can either state that the employee is not fit for work, or that they may be fit for work if certain adjustments are made, and those adjustments can include things like reduced hours, amended duties, remote working, or a phased return. Now here is the important part. A fit note is significant medical evidence. Employers should take it seriously. But a fit note does not necessarily mean the employer must automatically agree with everything written on it. For example, if a GP recommends reduced duties but the employer genuinely cannot accommodate those adjustments operationally, they may not be required to implement them. However, they should still consider the recommendations properly. Simply ignoring a fit note completely or dismissing it without discussion can create legal problems. We dealt with a case involving an employee suffering from anxiety and depression, whose fit note recommended remote working temporarily. The employer refused immediately without meaningful discussion, and later started disciplinary action linked to attendance. That became a serious issue when disability discrimination claims were raised. And this is where fit notes often overlap with the Equality Act 2010. If the underlying health condition amounts to a disability, employers may have a duty to make reasonable adjustments. That is why these situations can become legally complex very quickly. Now let's address another common myth. Can employers contact you while you are off sick? Yes, generally they can. Reasonable communication during sickness absence is normal. Employers may need updates, occupational health assessments, or discussions about returning to work. But there is a difference between reasonable contact and constant pressure. Repeated demands to return early, aggressive questioning, or excessive monitoring while someone is signed off can potentially create legal risk, particularly where mental health is involved. Another issue we see regularly is employees returning to work too early because they feel guilty or pressured. That can sometimes make health conditions worse and create even longer absences later. So if you are off sick and have a fit note, what should you do? First, make sure you follow your employer's sickness reporting procedures properly. Second, keep copies of fit notes, emails, and workplace communications. And third, if your employer is ignoring medical advice, refusing reasonable adjustments, or treating you unfairly because of your health, seek legal advice early. At Blackstone Solicitors, based in England, we help employees dealing with sickness absence issues, disability discrimination, and workplace disputes linked to ill health. Because when medical professionals say you need support, employers should not simply ignore it,